Blood flukes, scientifically known as schistosoma, are prevalent parasites that affect millions of individuals worldwide. These flatworm parasites utilize snails as intermediate hosts and latch onto human skin, making their way into the body. Initial symptoms such as itching and rashes are followed by more severe manifestations like diarrhea, coughing, headaches, and fever. If left untreated for years, blood flukes can spread their eggs to organs like the lungs, liver, bladder, and even the spinal cord and brain, leading to paralysis and seizures. Primarily found in Africa, the Middle East, South America, and parts of South Asia, blood flukes pose a significant socio-economic burden, particularly impacting children who may experience learning disabilities and malnutrition. The horsehair worm, also known as Gordian worms or Nematomorpha, presents a peculiar parasitic relationship. Although not directly harmful to humans, these worms target crickets as their hosts. After hatching as larvae in watery environments, they await ingestion by crickets. Once inside the cricket's body cavity, horsehair worms absorb nutrients while manipulating the cricket's behavior, ultimately leading it to drown. The worm then emerges from the cricket's body, finds a mate, and lays eggs to continue the cycle. Roundworms, responsible for filariasis in humans, are transmitted by flies and mosquitoes. These parasites invade the bloodstream, and if they reach the lymphatic system, they can cause severe swelling of limbs and genitals, along with thickening and pain in the skin. Filariasis affects nearly 1 billion people across 80 countries worldwide, but fortunately, oral drugs like diethylcarbamazine can effectively treat the infection and prevent its transmission. The tsetse fly, prevalent in Africa, is a carrier of trypanosomiasis, also known as African sleeping sickness. This parasitic disease affects millions, primarily in rural areas. Symptoms include headaches, fever, joint pain, poor coordination, confusion, muscle weakness, paralysis, and sleep disturbances. Without treatment, African sleeping sickness can be fatal due to organ failure. While the disease has been present for centuries, advancements in modern medicine have reduced the death rate significantly. The emerald jewel wasp, also referred to as the emerald cockroach, exhibits a gruesome parasitic strategy. Native to South Asia, Africa, and the Pacific Islands, this wasp paralyzes cockroaches with its sting and leads them to a burrow where it lays eggs inside the roach's abdomen. Over several days, the wasp carefully controls the amount of venom injected to keep the roach alive while its larvae feed on the roach's organs. After the larvae mature, a fully grown wasp emerges, and the cockroach finally succumbs to its fate. The loa loa, known as the eye worm, causes loa loa filariasis, a skin and eye disease. Transmitted through deer flies, these worms can reside in humans for up to 17 years. Symptoms include itching, swelling, pain, fluid buildup in the testicles, damage to the large intestine, arthritis, damage to the retina, infection of lymph glands, and kidney disease. Medications alone are often insufficient, necessitating surgery along with drug treatment. Approximately 12 million people in 11 African countries are affected by this parasite. Onchocerca volvulus, a parasitic nematode responsible for river blindness, is the second leading cause of blindness worldwide. Transmitted by black flies near rivers, the worms migrate to the surface of the skin and eyes, leading to blindness. Other symptoms include skin bumps, severe itching, epilepsy, and Mazzotti reaction, which can be life-threatening. Sub-Saharan Africa is the most affected region, but progress has been made in reducing the disease's impact. Anisakis, a type of parasitic nematode, poses a risk when consuming raw or undercooked seafood. This condition is prevalent in regions where raw fish is commonly consumed. After ingestion, the nematodes attempt to penetrate the intestinal wall, causing severe abdominal pain. Immune cells respond by forming a barrier, blocking the digestive tract and causing malnutrition, vomiting, and, in severe cases, symptoms resembling Crohn's disease. Whipworms, responsible for trichuriasis. Infect hundreds of millions of people in tropical regions. Symptoms include bloody diarrhea, abdominal pain, anemia, weight loss, rectal prolapse, and learning disabilities in children. Whipworms are typically transmitted through contaminated food or soil. Medication like mebendazole or albendazole is used for treatment. The guinea worm, also known as dracunculiasis, thrives in contaminated water. Humans become infected by drinking contaminated water, and the worm can grow up to 3 feet long inside the body. The worm emerges through painful blisters on the skin, requiring slow extraction over several days. Great progress has been made in eradicating the guinea worm, with only a few hundred cases reported annually. Preventing parasitic infections involves practicing good hygiene, avoiding contaminated water and food, and seeking medical attention if an infection is suspected. Understanding these parasites and their impact empowers individuals to protect themselves from the dangers they pose.